My name is Samantha Gonzalez, and I'm a senior at Walter G. O'Connell Copic High School. And my question is, how do you think COVID will further impact the health disparities since COVID impacted minority communities heavily? If so, are there going to be any future accommodations put in place to combat this?
We've already highlighted that yes, that COVID has been disproportionate burden on minority communities, and just to repeat, these are structural inequities. Number one. Secondhand is greater rates of certain risk factors for more severe manifestations, and third, the limited access to care for some of the populations, whether it's insurance or having a place to go, so that early symptoms were not being managed adequately. We still don't have a great treatment for COVID, but we've gotten much better at diagnosing it early and then anticipating complications and managing them much better. And some medications are helpful in preventing people from getting severely ill. So all of these factors are important in that regards. Our hope at NIH, our expectation really, just to be aspirational here, is that this crisis has created a response on our part and on the part of the Department of Health and Human Services to really continue to invest in this type of infrastructure. And they're highlighted on three things. One, the value of having community engaged research. So full partnerships with community-based organizations, school districts, faith-based organizations, community clinics that aren't part of academic health centers, and other community organizations is really important. And it's just not just relevant for minority communities, but it's relevant for all communities. Let's say 50% of the population is healthy enough and doesn't really need a lot of help to get what they need. But there's another proportion that needs a lot of support and a way to facilitate that. And I think community engaged research is a model that we know can work. And we've been working in this area for 20, 30 years. And now we're investing in it in a way that hopefully will persist so that we can use it for other things like diabetes and substance use, et cetera. Actually, in substance use, similar programs have been developed. The second is that these structural inequities need to be addressed. That's a long-term effort. How do we create healthy communities? How do we have people be able to go to a full-service supermarket and buy affordable, healthy food, as opposed to the wall of junk that we see at most food stores? And I think that because it's cheaper, that's what our population, our community goes to get easier. And that's something we need to. It's going to take work. It's going to take changes in policy at many levels. It's going to take more than the health sector to work at that. And then the part of the health sector is making accessible, culturally competent, and cultural humility in our healthcare system, so that we address equity as a goal and not just certain quality measures or efficiency measures that we usually use. I'm a physician, so although I don't continue to practice medicine in this job, but I'm very sensitive and familiar with how the power that a trusted primary care clinician can have with patients, and magnifying that by hundreds of thousands, I think we can have a bigger impact. And then the last point is, I think the value of communication, the importance of messaging and having trusted messengers has become more clear than ever. And then repeating it and being consistent. No happy talk, just give the facts, answer all questions, use common language that everyone can understand. And if you've watched Dr. Tony Fauci speak, you'll understand in part what I'm referring to. And there's so much misinformation out there that gets easily disseminated through social media that we cannot be complacent and wait for things to sort of bubble up and be clear. No, we have to be proactive in this. And I think as scientists, and leaders in government, we need to be at the forefront of that. But we ask everyone else to do the same thing, all the community leaders. And I think the community, the physicians and clinicians of color have really stepped up on the vaccine issue as much as is feasible. And we're very, very happy and proud to see that develop.